Oh, um, we did another one. This is another debate. So this resolution was this house would legalize marijuana. We defined this house. Actually, I'll put it in the description, the definitions and stuff. And if I don't, just let me know and I'll put it down there. So yeah, this house would legalize marijuana. I was the government side, and Gio was the opposition side. So we would like to do the thing where if you think government won, hit the like button, and if you think opposition won, hit the dislike button. And we'll see. We'll send it to some more people. Hopefully, we'll get more people to give us feedback this time. So yeah, give us some feedback. Thank you, Mr. Speaker. The government today is proposing the resolution that this House would legalize marijuana. And by this we mean we legalize all commercial and personal use as the US government. And we mean basically every type, every form of or every type of chemical in the common forms of marijuana. So both CBD and THC. We do this under the rationale that we want to support the well-being of our citizens. To this end, we have three contentions for you today. One, that we provide medical benefits through our plan. Two, that we reduce crime. And three, that we avoid undeserved punishments through passing our resolution. I'd like to begin with the first one, with medical benefits. There's a huge problem today, or rather, we want to address two huge problems today. One is the problem of access, and the other is the problem of quality with marijuana. Let me talk about the first one, which is also our first subpoint, that we increase access. Right now, it's hard to get medical marijuana because it is so expensive. It's thousands of dollars, even though people use it to treat depression and PTSD, and it is actually tremendously effective. Veterans, especially, are one huge group that really need medical marijuana. We can see that suicide rates and especially extreme depression rates are much lower among medical marijuana users than those who opt not to. But our second subpoint under medical benefits is that we increase the quality of marijuana. And this is super important because most people who suffer direct consequences from marijuana suffer consequences, medically speaking, from how they choose to ingest marijuana. When we make it legal, we allow people to sell it in different forms, in safer forms, because the government can now regulate it, leading to less people dead. Ultimately, we save lives by giving people access to medical marijuana, and we save lives by preventing people from ingesting harmful, bad quality marijuana. But yes, we basically make it safer through medical means. But we have a second contention that we actually reduce crime by legalizing marijuana. And this may seem counterintuitive because why would we have less crime by legalizing a drug? Will more people just sell it? But the way we legalize crime, we reduce crime, is by driving out gang violence, which is the major source of homicides in a lot of states, in most states, in fact. And the way we do this is when we make marijuana legal, the prices will fall because we can now supply it, and a lot of the expense is really to buy marijuana that you're paying for when you buy marijuana is really about people who avoid the law. It's that risk expense. That's why you pay so much for it. When the prices fall, gangs can no longer sustain their operations because, after all, they have to employ a lot of people with a lot of risk. It's very expensive, and they simply can't continue with low prices. It's simple supply and demand. We've seen this in LA with marijuana, in Chicago, in studies in Chicago with heavier substances like cocaine or heroin. And in every case, crime is significantly reduced. We save lives here, and everyone who's not affected by gang violence gets to grow more and develop more, which is what we want for the well being of our citizens. Our final contention is that we avoid undeserved punishments, because marijuana is often used to target people, especially minorities. If you are black, you are 4 times more likely to be arrested for carrying marijuana, even though white people and black people carry marijuana at the exact same rates and consume at the same rates. And there are legislators that openly admit, or at least in private, and they've been recorded and publicized, that they have implemented certain laws relating to marijuana in order to persecute select communities, like black communities. And the sentencing is super harsh, and it's hard to be addressed because a lot of the time it is intentional, and we can't really get rid of it unless we legalize marijuana. The impact here is we help end persecution to select communities, improving their health and well-being. This is a huge issue because 2% of our entire prison population are in there because of marijuana possession, which is totally undeserved and detrimental to our society. It's also expensive because every cent we spend paying for people to go to jail for marijuana possession is a penny we're not spending on public welfare. At the end of the day, legalizing marijuana, though counterintuitive, is the only way to reduce the medical harms, to reduce crime, and to avoid unnecessary punishments. Thank you, Mr. Speaker.
Thank you, Mr. Speaker. Now, side government has addressed a certain problem that we've seen in the country and we've seen come particularly prominent, especially in the 2020 elections. That is, how do we deal with the problem of marijuana and the overuse of marijuana in the United States? Now, fundamentally, it's because side opposition does not believe that legalizing marijuana would lead to the overall well-being and safety of our citizens that we are proud to oppose the following resolution. In this speech, side opposition would like to do the following few things. Firstly, we'd like to reaffirm the rationale. Secondly, we'd like to provide a refutation to the government's 3 points. And then thirdly, we'd like to introduce 3 contentions under our rationale. So under a rationale, once again, similarly to side government, we believe that the safety of our citizens is of utmost importance in this round of debate. So now I'd like to proceed to refute the opponent's 3 contentions. In their first contention, they claim that legalizing marijuana is going to have significant medical benefits. And they talk about A, the access, and B, the quality of the marijuana. But once again, the quality of marijuana is already guaranteed in hospitals. So legalizing marijuana wouldn't make legalizing marijuana wouldn't make the quality of marijuana, at least in the hospitals and the settings in which people are actually getting them through prescriptions and stuff, isn't actually going to make it any better than it already is. Moreover, it might actually have detrimental consequences because people will take the matters into their own hands and treat themselves with legalized marijuana rather than going to a hospital that prescribes it for them in safe doses that would actually help the mental health of the veterans, as side government was talking about. So once again, legalizing marijuana is more likely to have detrimental consequences because people would go away from hospitals and take matters into their own hands, where oftentimes it's cheaper to buy it on the street than, for example, go through a hospital. Now, onto their second contention. They claim that it's going to decrease crime, and they talk about how it's going to drive out gang violence because the prices of marijuana are going to fall, and as a result, gangs are going to be less profitable when they're dealing with marijuana. But once again, this doesn't actually solve the problem. Indeed, side government is right in their assessment in that the prices of marijuana might fall, but this won't actually mean that gang violence is going to decrease. At least, there's no substantial evidence that suggests that is true. Because gangs aren't going to suddenly stop. For most people in the gangs, this is a significant source of income for them and for their families. So they're more than likely going to switch to other profitable ventures rather than suddenly just dropping all of their criminal activities. They're going to try to find different ways of getting the amount of money for their families and for themselves. And once again, just because they may stop dealing in terms of marijuana, it doesn't actually mean that gang violence is going to fall as side government assessed. And now onto their third contention. They talk about how it's going to decrease undeserved punishments. And as part of their evidence, they cite the fact that Black people are 4 times more likely to be arrested, even though the amount of Black people and white people who do marijuana are at roughly equal rates. But once again, this has less to do with marijuana as much as it has to do with a systemic problem in the United States. So legalizing marijuana wouldn't actually address this problem. Now, it's not just marijuana. It's not just within the realm of drugs in which Black people are arrested at significantly higher rates. We see this across all we see this across all criminal activity. We see this that even though Black people commit or for example, we see the fact that Black people are more likely to be pulled over for absolutely no reason than white people, and we see this across a bunch of other platforms as well. So once again, this notion that merely because we are going to make marijuana legal is going to mean we're going to solve these systemic problems, quite frankly, isn't true, and is a misidentification of a problem. Once again, they're trying to address a symptom of the problem instead of addressing the root of the problem, which is once again this systemic injustice and this systemic problem that we have within our criminal justice system, as opposed to the effects of marijuana on this inequality. Yes.
If someone is afflicted with a serious illness and it takes time to address the cause, the root of it, do you think it's worth addressing the symptoms so that they remain alive?
Well, I mean, if indeed in the cases where they would have to stay alive, then yes, it would probably be better to do what you just asked in your point of information. But it rarely comes down to that. And okay, so that brings me to the first of 3 contentions. Or actually, I'd like to outline our 3 contentions first. Firstly, we believe that legalizing marijuana would harm users. Secondly, it would harm people around the users. And thirdly, it would deconstruct our beneficial negative stigmas around marijuana. So firstly, it actually harms users. So under this, we have 3 subpoints or 3 examples. Firstly, since the 2000s, there's been an increase in psychosis, which is this distortion of reality in Finland and Denmark among all since they legalized marijuana federally. Secondly, we've seen since 2014, there's been an increase in aggravated assault in places that did legalize marijuana, such as Colorado and Washington. And thirdly, it's a gateway drug, and people are far more likely to go onto other much more dangerous drugs than marijuana if they even start. So once again, making it far more difficult to access would once again decrease the chances that people would use marijuana as a gateway drug. And that brings me to my second contention. It harms the people around the user. 50% in 50% of fatal accidents, HTC has been found in the individual users' systems. Now, we can see the direct impact on this. People who are using marijuana and driving have far slower reflexes, which means that they're far more likely to get in accidents and harm other individuals around that person. So this comes in direct conflict with the fundamental values of protecting the safety of our citizens. And now, moreover, the addiction of individuals who are on marijuana and who are addicted to marijuana will directly harm family members, not only in terms of finances, because now it's a financial drain onto all of the people around them, but also it causes significant mood swings, which once again significantly harms the people, the social and the social anxiety within individual households. And once again, that has significant ramifications. It makes the children, for example, far more likely to have anxiety, depression, and also far more likely to become addicted to either drinking or other types of drug abuse as well. So now onto our third contention of it deconstructs our beneficial negative stigmas because it is currently legal. And once again, this has to do with the very nature of the resolution. Because we're legalizing marijuana, we're making it far less likely that people will think that it is inherently negative. A lot of the reason people are staying away from drugs, and hard drugs, for example, is because we've made it illegal in the past, and because there's been a very negative stigma that is associated with doing these drugs, which means that people are scared of them. And this element of fear keeps them away from trying it. But once again, if we legalize marijuana, even if it may have some purported benefits, it's going to make it such that people are far more likely to use it because there's no longer as much of a stigma that is associated with it. So once again, this leads us to all of the negative effects that I've talked about. Namely, it harms individuals users, it increases addiction rates, and it harms individual families, and it harms the people around families. And for all of these reasons, deconstructing these negative stigmas cannot happen. It's for all of these reasons we believe that side government's plan cannot pass because it directly threatens the safety of our citizens and all of the additional harms that I've mentioned in our I've mentioned in this speech, and it's for these reasons I'm proud to oppose the resolution.
Thank you, Mr. Speaker. We're glad that opposition understands or opposition agrees with us that these problems exist in the status quo, that people are clearly suffering because marijuana is illegal. Now, there are cases that we will do more harm than good with our plan, and we're here to prove to you that that's not going to be the case. I'm going to start doing that. I'm going to do that by beginning with rebuilding our contentions before refuting some of our opponents' contentions. Our first contention is about medical benefits, and it's about improving access for people who need marijuana and improving quality so people don't get sick or harmed by taking marijuana. So about access, they said hospitals are still going to are still going to be expensive, and people are going to go buy on the streets, which we admittedly is a point that we forgot to address, and we'd like to do that now. The reason hospitals would also have cheaper marijuana and we would have cheaper marijuana through legal forms is because we can reduce regulation, right? Which is the reason it was so expensive to begin with, because we had to make sure it doesn't get on the street and it stays within legal boundaries. So with that gone, the cost is going to drop, and veterans and everyone else who need it, who need marijuana, can get marijuana for medical usages. And they said, self dosage may be harmful for these people. But the fact is, the reality is, it's already self administered today. It's assigned by a doctor who recommends a dosage, and people take it. And sometimes they take more, and sometimes they don't take as much, depending on how they feel. And that doesn't really prove to be a danger, at least not currently. And we don't see why that would change. Our second subpoint on quality is about government regulation leading to better, safer marijuana. And they said this is already guaranteed in hospitals. But we're not really talking about hospitals with this subpoint. We're talking about all the people who buy street marijuana and get sick or get hurt, get harmed that way. We basically help a lot of those people by making sure they get it through regulated legal means that are safe. So with that, we've established that we do in fact bring medical benefits. Let's move on to the crime. Our second contention is reducing crime, and basically drive out gang violence by making sure that they have no business to do. And the opposition said they would simply switch to something else. They'd do something else that's just as violent. But that doesn't seem to be true in the real world, right? As we've given examples of LA and Chicago, where gang violence just decreases. Because, there are oftentimes gangs are like businesses, and they can go bankrupt and they can go out of business, and they just dissipate. And even if they don't, they lose their primary source of income. Right? If they switch to something else, they have to spend a lot of time building, and oftentimes they probably selected marijuana in the first place because it was the most profitable, so they have to go on to something that's less profitable. Ultimately, this means either they go completely or they decrease in power, which reduces crime in either way. Right? And we see that in real life through the points of evidence that we provided. So we'd reduce crime. But our final contention is that we avoid undeserved punishments. And they didn't really talk about the impact of what we would do, because I believe they agree that should it work, we do help a lot of people in a lot of ways. But they said this is not just about marijuana, and we won't actually solve the whole problem of racial targeting, right, through addressing this. And I said that we're only addressing a symptom of racial targeting, and we have to fix, racism, which admittedly is a very hard thing to do. And as they admitted, if fixing the root of a problem is going to take a long time, we should probably address the symptoms so people are hurting less. And that's what we're doing. We're not fixing everything, but this is a good step to help people to alleviate the problem a little bit. So we don't find their refutation very convincing, since they kind of say that, if you can't fix the whole thing, don't fix a little bit of it, which we don't believe in at all. So with that, I'd like to move on to our opponent's contentions. Their first contention is that we harm users through this legislation. Through we harm users through their use of marijuana. And they bring up an increase in psychosis, an increase in aggravated assault in certain places where marijuana is legalized. But we'd like to point out that this is correlation and not causation. And although we can't speak in depth about psychosis, even though we believe that the general trend in Europe has been going up, even in places without legalized marijuana, we can definitely speak about aggravated assault in the United States, in which the states that they listed such as Washington, increased in aggravated assault about as much as the average state did in the United States over those years. So again, this is correlation and not causation. And the second, and yeah, that's plain. And there's no added increase in psychosis or aggravated assault by marijuana usage. They also talk about marijuana as a gateway drug, that we could get people hooked and interested in more serious drugs. But there's just simply no evidence for that. Study after study suggests that people who use marijuana are less likely to get addicted to greater drugs, to more serious drugs, than people who use alcohol or people who smoke. Right? Nicotine is more inducive as a gateway drug than THC. So ultimately, there's no real evidence that it harms as a gateway drug. Their second contention is that we harm others through this legislation, and they point to driving and addiction. So we'll talk about those separately. Not only do we think that these 2 points do not undermine this resolution, we believe it actively furthers this resolution. When they talk about driving, they say 50% of people who are involved in fatal car accidents have THC in their system, which is true. Which is true. But they didn't address the reason for this. And people have done studies and found that the reason for this is largely that people don't know that you can't drive when you are under the influence of marijuana. Because when you buy marijuana on the street, which is what most of these people do, they obtain it illegally, they they don't know because people on the street selling you illegal marijuana aren't going to instruct you how to use it responsibly. And we can do that should we make it legal. We can increase education on driving and THC usage through marijuana so that we can actually lower this percentage a lot and make driving safer. When we talk about addiction, similar thing happens. They talk about harm to themselves and to others through addiction. But again, most of this addiction is peddled by illegal usage, irresponsible usage, and usage we can prevent by allowing people to seek help through legal means and not get in trouble for it if they need help. And also by instructing them how to use things responsibly through regulation, through vendors, right? We have to make sure everyone who buys marijuana knows how to use it. And we can only do that through legal regulation. Hence, we would actually make it safer for people, not because we'd make it safer driving, we'd make it safer for people who have addiction. Finally, they talk about deconstructing stigmas. And there's a fair point here, logically, but when we look at the evidence, there's not a significant increase in marijuana usage even after you legalize it. It's a few percentage points tops in states like Washington, for example, and it's just altogether not super serious of a problem that we have to deal with. On balance, we see medical benefits, reducing crime, and avoiding undeserved punishments that affect the population in such a great extent. It greatly outweighs any of the possible harms that this legislation might have. So with that, Mr. Speaker, I urge you to vote in favor of this resolution, to take care of our citizens, to take care of the well-being of our people. Thank you.
Thank you, Mr. Speaker. At this point in the debate, side opposition stands in firm opposition to the resolution that this House would legalize marijuana, once again on the grounds that legalizing marijuana would be fundamentally detrimental to well-being rather than beneficial to it. In this speech, I'd like to do the following few things. Firstly, I'd like to provide a rebuttal or refutation to the points introduced by side government, and then finally rebuild the points of side opposition before finally boiling this debate down to a crux. So we responded to their first contention of medical benefits by saying that, once again, having this opportunity for people to go into hospitals is actually more beneficial to our citizens. Now, side government responded that we would actually save money by reducing regulation because now hospitals don't have to make sure that this medical marijuana isn't out on the streets. And they also talk about people already self-administering. But once again, there's now no longer a reason, if we pass our plan, for people to go to the hospital in the first place. Once again, people are self-administering, as side government stated, but the thing is, they're self-administering with the doctor's recommendations. Now, going into the doctor's office is extremely expensive. For example, with our health insurance, you often have copay and co-insurance that ensures that you have to pay a certain amount of money in order to go to the doctor's office. Now, while this may seem costly to the individual user, this yields long-term benefits. Namely, people are advised, no thank you, people are advised to use medical marijuana in a way that is safe and in a way that is advised by a doctor. But if it's so cheap that they no longer have to go to a doctor, a lot of veterans who are historically much poorer than the average American citizen will now find no reason, as a matter of fact, they would find a disincentive to actually go into the hospital and get medical marijuana in a way that is safe and in a way that is advised that is safe. Yeah.
What avenue do you expect people could possibly obtain marijuana where they wouldn't be where they wouldn't be instructed on how to use it and how much to use?
Wait, sorry, can you say it again? Can you say that
Yeah,
again?
yeah. Where do you think people can go to buy marijuana such that they won't be instructed on how to use it and how much to use?
Well, under the current status quo where it's illegal, they would have to go to a black market. But once again, that's far more costly. And if we make it legal, then like marijuana would be far cheaper. So once again, the fact that it's illegal right now drives up prices, as you stated in your second contention, which makes it such that people are far less likely to get it because they don't have the financial resources to even buy it in the first place. So secondly, to talk about, once again, it's safer because once again, they talk about it's safer. Marijuana would be safer if we legalize marijuana because it's not in the black market. However, the mere fact that we're decreasing the amount in which people can actually access it because black markets make marijuana in general far more expensive already renders it an impossibility for most American citizens because they don't even have the financial resources to obtain that marijuana in the black market. Unfortunately, yes, it is a problem for the people who get it in the black market, but once again, that problem is significantly mitigated by the fact that it's legal. Now, in the second contention, they talk about how it's going to decrease crime, and we respond that that gangs are going to switch to more profitable ventures. But once again, side government responded that it's not true in the real world, and that these gangs are going to go bankrupt, and they're at least have to take up a new business. But once again, that's an extremely short-term solution, and that doesn't actually yield any benefits in the long run because the changes in supply and demand are going to be such that, once again, even if some gangs go bankrupt, there are other gangs that are going to rise up and take their place, and that's not actually going to solve any problems related to the amount of gangs in our country. Now, in response to their third contention, which we claimed, or they claimed that it's going to decrease undeserved punishments, and we responded that has much more to do with systemic problems in the United States. Once again, side government responded that we're first trying to address the symptoms, which once again helps their overall case. But once again, side opposition was merely pointing out that there was a disconnect between their analysis that they provided and the fundamental impacts that they purport in which their contention and their plan is going to help. Because once again, this problem with incarceration at higher rates because of marijuana has nothing to do with marijuana at all, and their third contention isn't even relevant to this case. So now onto our contentions. They responded to our first contention where we claimed it harms users by saying that most of the time it was correlation, not causation. And there was an increase in the same amount of overall crime in other states outside of Colorado. But once again, the correlation is extremely strong correlation to the point where we can almost prove causation. Because once again, as we pointed out, in 50% of accidents, this has been, or people have found or THC in the individual systems. Now, once again, they've responded to that by saying that once again, a lot of people are getting like from illegal places, but we'll get to that later. So once again, they talk about how it's going to increase the same amount, but once again, that's factually incorrect. Colorado and Washington increased their aggravated assaults at significantly faster rates than nearby states. So once again, that's factually incorrect, and that's just not actually true. And now, in response to our second contention, where we talk about how it harms people around the users, and we talk about that 50% of fatal accidents HTC has been found in individual systems. Now, side government responded that the reason is because people don't know that you can't drive when you're on marijuana, and that people are most likely getting it illegally. But once again, that is a pure statistical fabrication of side government. There's no evidence to suggest that people are actually getting it illegally, and they don't know that they can't go on marijuana. Now, in response to our third contention, in which we stated that it deconstructs our beneficial negative stigmas, side government responded that there's no increase in marijuana usage. But once again, we haven't done this on a federal level, so we don't actually know that in the examples that we've provided in this round of debate, that those are actually relevant if we were to do this on a national level, because the national level is far more significant than any small, minuscule testing that we've ever done in any examples. So once again, we can't just apply these small examples and say that it's going to be true on a federal level. Once again, logically, this is true, and side government conceded this as well, in that, once again, people feel far more likely to use it because there's less of a fear of using marijuana in the first place. Honorable Judge, what does this debate ultimately boil down to? It boils down to two things. Firstly, whether marijuana is actually dangerous, and secondly, does their plan make it more dangerous or less dangerous? So, whether marijuana is dangerous. Yes, we've already addressed in this debate that, once again, it's significantly more likely to make people addicted to marijuana. It's going to it acts as a gateway drug. And once again, it threatens the lives of people who use it, as well as the people around individuals who use it. So the question is, can we make this a better problem, or can we make this problem better or worse through the implementation of side government's plan of legalizing marijuana? And once again, we've seen that this isn't true. Legalizing marijuana would do far more in harms of the individual's well-being. For example, it bypasses hospitals. People would feel far more compelled not to go to a hospital to get their medical marijuana, and far more likely to just use their own prescriptions to deal with their problems. And now this leads to a bunch of other problems as well, as we've already addressed. It increases addiction rates. It increases the chance that people are going to get in accidents and threaten the lives of themselves and the individuals around them. It increases anxiety in homes, and it threatens the lives of individuals, and once again, the children of those individuals. It's because this is a detrimental problem that will only be exacerbated through the implementation of side government's plan. We are proud to oppose the resolution.
Thank you, Mr. Speaker. Fundamentally, when we address whether or not our plan is helpful to fixing the status quo, we have to talk about two things: the effect on safety and the effect on society. And we believe inside government that we improve both. We'll talk about safety first. When we talk about safety, we talk about medical benefits and reducing crime. Under medical benefits, it's clear that we provide them. They didn't even dispute the quality point, that there would be more quality marijuana that's safer to consume because of government legislation. After all marijuana is legal now, so you get it through legal means and you get better quality. Under access, a similar argument stands unrefuted, because they said that they said something along the lines of people would go on a black market or something like that, but no, they won't. They buy it through legal means, and they're necessarily, by regulation, they have to be instructed by whoever is selling them how much to use and how to use responsibly, and whether or not they can drive or under the influence. Right? Those are all things that we can do only with legal regulation. So yeah, we improve safety. In response to that, there's increased and aggravated assault, which is their only sub point that they've even bothered to rebuild under their first contention, and the driving thing that they brought up. Again, we prefer a world where we can instruct people to do what makes them safe, right? We can tell them, hey, don't drive under the influence, because most people don't know that, and that's why the THC rate in fatal accidents is so high. With aggravated assault, it's relatively a small increase, and it's clearly a cherry-picked piece of data. Right? If you look at fatal gun deaths, for example, they significantly go down because you reduce crime. Ultimately, the safety point on government side greatly outweighs the negatives opposition brings up. But what about the society point? And here we talk about whether avoiding undeserved punishments is better than the deconstruction of is better than the addiction point that they bring up. They say that we affect society negatively because people are addicted. It affects their family and stuff like that. We insist that it's better that we allow these people to seek help and instruct them how to use responsibly so this never happens, than to just let the current status quo continue, where this is already affecting a lot of people. Addiction already affects a lot of people, when we can fix that through our plan. Furthermore, even if that was not the case, our avoidance of putting a huge number of people, millions of people, in prison every year for undeserved crime clearly outweighs that point in terms of societal benefits. Under every standard of evaluation, Mr. Speaker, our plan improves the well-being of our citizens. And I urge you to vote in favor of this resolution. Thank you.